Pubertal disorders. Puberty is defined by the appearance of secondary sexual characters. First change in puberty in females is thelarchy, occurs earlier than males, and in males it's the increase in the size of testes. Delayed puberty. Definition. In male, pubertal changes does not occur until 14 years of age. In female, absence of thelarchy of more than 13 years, and absence of menarche more than 16 years of age or after 5 years of thelarchy is considered delayed puberty. Etiology. Most over common cause is constitutional delay in growth and puberty, also most common cause of short stature. Central hypogonadotropic hypogonadism. Due to pituitary gland or hypothalamus gland disorder, you have your central hypogonadotropic hypogonadism. Decrease luteinizing hormone, decrease follicle stimulating hormone, decrease sex steroids. Syndromes. Kallman syndromes associated with anosmia. Prader-Willi syndrome, genomic imprinting disorder, obesity, almond eye, small hands, Lawrence-Moon-Biedl-Bardet syndrome, obesity, polydactyly, retinitis pigmentosa, CNS injury, trauma, infiltrative disorders of pituitary, histiocytosis, sarcoidosis, etc. Peripheral hypogonadotropic hypogonadism due to decreased sex steroids, feedback, increased LH and FSH. Peripheral hypergonadotropic hypogonadism due to decreased sex steroids and feedback, increased LH and FSH. Chromosomal anomalies, Turner syndrome, streak ovaries, Klinefelter syndrome, cryptorchidism, decreased testosterone production. Congenital adrenal hyperplasia, decreased Al-17 alpha hydroxylase, delayed puberty in male. Insufficient androgen action, androgen insensitivity syndrome, 5-alpha reductase deficiency. Androgen insensitivity syndrome, pathology, resistance to androgen action, genetic defect, AR gene mutation. Androgen insensitivity syndrome, IAS, pathology, resistance to androgen action. Mode of inheritance, X-linked recessive. Karyotype 46 plus XY. We are reading about androgen insensitivity syndrome. So karyotyping is 40X plus XY. Phenotype, appearance of classical form. Features vary with severity of resistance. Female, breast development, androgen insensitivity syndrome, increased level of testosterone, aromatase, estrogen X on breast tissue. Uterus absent, pubic and axillary hair absent or spare, undescended testis, palpable inguinal mass. 5-alpha reductase deficiency, pathophysiology, testosterone is acted by 5-alpha reductase, which will make 5-dihydrotestosterone, which will be reduced, which result in decreased development of male external genitalia, fusion of scrotum and lengthening of penis. Fusion of scrotum and lengthening of penis. Clinical features, female-like features, child is raised as a girl, puberty, increased testosterone levels, spontaneous virilization, apparent change of gender, management, replacement of sex steroid in males more than 12 years, ethinyl estradiol, oral progression 2 years later to achieve breakthrough bleeding in males more than 14 years. Testosterone, early administration, early fusion of epiphyses can result in short stature. Precocious puberty, definition, pubertal changes occurring in males less than 9.5 years and in females less than 8 years old. Etiology, central gonadotropin dependent. Disorders in hypothalamus and pituitary. Idiopathic, most common in females. CNS pathology, most common in males. Hypothalamic hamartomas. Hypothalamic hamartomas is the most common CNS pathology in males. Other feature, galactic seizures like uncontrollable laughter. Other features of hypothalamic hamartomas are galactic seizures, uncontrollable laughter. Increased peripheral gonadotropin independent functioning tumor, more common in testes, increased testosterone production. Leydig Sertoli cell tumors, more common in testes, increased testosterone production, Leydig Sertoli cells in tumor. Autonomously functioning ovarian cyst, McCune-Albright syndrome. Autonomically functioning ovarian cyst, McCune-Albright syndrome, increased production of estrogen. Congenital adrenal hyperplasia, deficiency of 21 hydroxylase and 11 beta hydroxylase, precocious puberty in male. McQuine-Albright syndrome, autonomous endocrine hyperfunction of one or more of the following. What is the autonomous endocrine hyperfunction of? Thyroid, pituitary gland, adrenal gland, ovaries. Then it is called McCune-Albright syndrome. Genetic defect, GNASI gene mutation, GNASI, GNASI gene mutation, gain of function, autonomous uncontrolled receptor activation, codes for alpha subunit of GS receptors, codes for alpha subunit of GS receptors. Clinical features, endocrinopathy, precocious puberty. Clinical features, precocious puberty, polyendocrinopathy, then cafe au spot, skin findings, and polycystic fibrous dysplasia, multiple lytic lesions in bone. So clinical triad is endocrinopathy, precocious puberty, cafe au spots, and polyostotic fibrous dysplasia, multiple lytic lesions in bone. And this is the gain of function syndrome, McQuine-Albright syndrome. So coast of main appearance, irregular margins, skin finding, spots do not cross midline, lytic lesions in brain. Most common affected sites is base of skull and proximal femur bowing, causing shepherd crook's deformity. Note, cafe au lait spots in neurofibromatosis 1 have regular margin, coast of California appearance. Cafe au lait spots in neurofibromatosis NF1 have regular margins. Coast of California appearance. Treatment of underlying condition. Medical management, McCune-Albright syndrome, aromatase inhibitor, for example letrozole, is not converted to final step of estrogen synthesis, decrease estrogen. Central precocious puberty, long acting GnRH analog, for example leuprolide. What else will you manage it with? Long acting growth gonadotropin releasing hormone analog like leuprolide. Sustained stimulation and desensitization of pituitary. Sustained stimulation and desensitization of pituitary, decreased luteinizing hormone and follicle stimulating hormone, and decreased sex steroids. In the next video we'll learn about diabetic ketoacidosis.